So how is hypersensitivity induced and exacerbated in IBD? In this video, we'll try to answer this question. So we talked about how in IBD, the immune system takes normally harmless bacteria and molecules in our blood to be foreign, which is what sets off either Crohn's disease or colitis. So when the immune system recognizes this foreign antigen to be present, it's going to tell the mast cells of the intestinal mucosa to release cytokines, chemokines, and other pro-inflammatory mediators, which all then can increase the permeability of the gut cells. So Th1-mediated cells are most common in Crohn's disease, and these include cytokines IL-1, IL-6, and TNF-alpha. Th2-mediated cells are most common in colitis, which includes cytokines IL-4, 13, and anti-inflammatory IL-10. Now, the mast cells that we were talking about are also in close communication with the sympathetic and parasympathetic nervous systems, which helps mount a greater inflammatory response. So this connection is called the neuro-immune cell junction. Now, usually the parasympathetic is an anti-inflammatory pathway, while the sympathetic is an inflammatory pathway, but stress decreases the parasympathetic outflow and increases sympathetic. So that's why intestinal inflammation is upregulated, and IBD is marked by an immunosuppressive state. So the CRF we spoke about previously, released from the hypothalamus in the HPA axis, also has receptors located peripherally on many mast cells and macrophages of the GI tract. This is believed to promote inflammation and hypersensitivity of the colon tissue as well. The gut is made up of billions of healthy bacteria that regulate normal digestive functions and aid in absorption of nutrients. Stress modifies the bacterial flora of the gut mucosa and actually can increase the susceptibility of infection to the molecules that leak through the more permeable gut lining in IBD. The enteric nerve cells release many neuropeptides, such as substance P and neuropeptide Y, because of the increased TNF-alpha present. Over time, it has also been observed that sympathetic nerve fibers and neurotransmitters are damaged in inflamed areas of the colon. So this may actually trigger stress to then creep and affect the non-inflamed areas where the nerves are still intact, which is what causes the spread of the disease. Scientists have also observed under microscopes that the nerve endings in the colon are damaged and that there's a thickened layer of substance P in these nerve fibers. Chronic stress also causes the relapse of IBD. So chronic colitis is associated with an infiltration of the CD4 T helper lymphocytes, which are the cells that cause the release of cytokines. The number of CD8 cytotoxic T cells are actually found to be lowered in a chronic immunosuppressive state. And there are also changes in blood flow as a result of this IBD pathology. So blood flow is increased in the early phase of the disease, as much as 25% of our cardiac output, compared to the normal 4%. But then as inflammation progresses, this blood flow is reduced. So if there's no cure for IBD, what's being done for patients? Well, the gold standard for a conventional IBD treatment is using anti-TNF therapy. Stimulation of the anti-inflammatory cholinergic pathway is also being studied as a possibility using either drugs or nutrition. Galantamine is a drug that induces vagus nerve activity, which we talked about is from the parasympathetic nervous system, and suppresses abnormal inflammation. A high-fat enteral nutrition is also used to increase the anti-inflammatory effect of CCK. This is a hormone responsible for our digestion and absorption of macromolecules in our small intestine. Complementary and alternative medicine therapies are also widely used in IBD, but there still needs to be a lot more research done. So these approaches focus on stimulating the parasympathetic nervous system to promote calmness and relaxation. Meditation decreases inflammatory IL-6 responses, and increases HRV. And Tai Chi and yoga have been shown to decrease sympathetic activity as well. Hopefully, this series of videos gives you a better understanding of stress on the neuro-immune interaction in irritable bowel diseases. The degree to which stress manifests physiologically obviously varies person to person. Hopefully, you have a deeper appreciation for how critical and complex these delicate systems are and the importance of the mind-body connection.